Hi, Mark Gilman, Recovery Lead for the National Treatment Agency. And the main thing is getting people to move from treatment into recovery and to work out how to sustain their recovery once they've left treatment. I think that's the main thing. I think there are three key points really. One is the communal nature of recovery. The idea that I can't but we can, that you alone can do it but you can't do it alone. And looking for help with other people, other addicts and other alcoholics in recovery, that's communal. It's a communal thing. Number two is to realise that it's actually new territory for a lot of us. You know, we've had treatment for a long time, we've had recovery for a long time, but having the two together and coexisting in an ecosystem is relatively new. And then the third thing is the acceptance that recovery is a long-term venture. You know, and that recovery does slowly what drink, drugs and medication in the past have done very fast. I think today's event's been absolutely excellent. It's very, very busy, it's very lively, there's a palpable buzz about the place and people realising that by coming together we can get a lot better results than each of us could on our own, both organisationally and individually. You can almost feel the collective working. Yeah, I think the payment by results the move towards payment by results is almost inevitable really in the economic climate as it is, and the desire to be able to prove that what you're doing is value for money. I think there's some very interesting and innovative ways that people are actually managing to do the payment by results work and also provide a high quality service. So I think rather than tilt at windmills really and wish it could go away, it's not that I can't see that it's going to go away. I think payment by results is here to stay for the foreseeable future, and the thing is to try and work out get the best results we can for it for the people at the end of it. It is difficult to manage the localism agenda and in the absence of a clear central steer. But I think there's enough momentum now in terms of treatment and recovery systems coming together to be able to articulate at each of the 150 partnerships what would have been said in the past by a central organisation. I think the difference is it might not be the people who you've traditionally looked to be the champions for that. So it might be the Director of Public Health, it might be the Chief Executive of the Council, it might be somebody else, it might be the new Police and Crime Commissioner. You know, I think the thing is to get 2 or 3 key messages, make it make sense economically and in terms of services to the key people, and then present it locally. So it's an agenda, if you like, that's derived from central information and central intelligence, but we find it's local purchase.